Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, COVID-19, What Families Need to Know, presented by Dr. Stefan Catalya, Infectious Disease Specialist with Washington Township Medical Foundation. And now, please welcome Dr. Catalya.
Hey everybody, thank you for tuning in this afternoon. Again, my name is Dr. Stefan Catalya. I'm one of the infectious disease doctors that works here in Washington Hospital Healthcare System. And today we'll be talking about different things that you and your families can do to protect yourself from COVID-19 as we reach the 2-year mark now of the pandemic arriving here in the U.S. Different topics that we'll be going over today. First, we'll be talking about the importance of being vaccinated, as well as which vaccines are available. Then we'll talk about the importance of getting COVID-19 testing done, either at home or in a clinic. The importance of mask wearing, even though, as we all know, that mask mandates are starting to get rolled back, and as well as COVID-19 treatments that can be both given in at home, in an urgent care setting, or in a hospital, God forbid you get admitted. Starting off then with the COVID vaccines, there are currently 3 vaccines in circulation to stop the spread of COVID-19 here in the U.S. The first 2 are the MODERNA and PFIZER vaccines. These are based off of a genetic material called messenger RNA, and these require 2 shots along with 1 booster. And then the other vaccine that's available is the Johnson & Johnson vaccine, which uses a different type of genetic material called DNA, and that one requires only 1 shot with 1 messenger RNA-based booster, that is like 1 Pfizer booster or 1 Moderna booster. The Advisory Committee on Immunization Practices, which is one of the leading healthcare agencies in this country that guides and provides advice on vaccines, prefers that either the Moderna or the Pfizer vaccines be given. That being said, the Johnson & Johnson vaccine can be given if either the Moderna or the Pfizer vaccines are not available. In terms of how they work, starting off with the Pfizer and Moderna vaccines, they teach our cells how to make a protein or even just a small piece of that protein that triggers an immune response inside our bodies. Basically, the COVID-19 messenger RNA vaccines, that is the Pfizer and Moderna vaccines, give instructions for our cells and our muscles to make a harmless piece of what is called the spike protein. This is that protein that's found on the surface of the virus that causes COVID-19. Here I attached a photo of a picture of the COVID virus. We've all seen a photo or some variation of this photograph over the last couple of years, I'm sure. And as you can see, those green little projections on the photo are what we call the spike protein. And this is what I've been referring to when I talk about the spike protein and where the messenger RNA vaccines work. So basically what happens is that when a person gets vaccinated with either the Pfizer or Moderna vaccines, this genetic material called messenger RNA is injected into a person's arm, and the muscle cells in that person's arm use the genetic material to make the spike protein piece. The muscles immediately get rid of that messenger RNA and display the spike protein piece to our immune systems. Our immune systems then recognize that that protein doesn't belong there and starts making antibodies. The antibodies almost immediately get rid of that spike protein, but fortunately for us, the antibodies remain in our system for a long time. So the idea is that, God forbid you ever do get into contact with the COVID-19 virus or any of its variants, these antibodies that are now formed in our bloodstreams can stop COVID-19 from causing a major illness. In terms of how the Johnson & Johnson vaccines work, these ones use a different genetic material called DNA, but otherwise, the step process is basically the same thing. Our muscles take the genetic material from the Johnson & Johnson vaccine, they make the spike protein, and that causes our immune system to form antibodies that remain in our systems for a very long time. We do get asked a lot of questions about the vaccines. The first one that probably gets asked the most is, are the vaccines safe? And the answer is yes. All the vaccines have gone through rather rigorous studies to ensure that they are as safe as possible. This includes meeting safety criteria set by both the FDA and the Centers for Disease Control, not just the safety criteria that was created by the different companies when they created their trials. And another question we get a lot is, if I got COVID-19, or if a person got COVID-19, do they still need to get vaccinated? And the answer is yes. Due to the risks of COVID-19 and reinfection, we still recommend that you get vaccinated against COVID-19. In terms of when you should get vaccinated after having recovered from COVID-19, that part gets a little bit tricky. The best thing to do would be to talk to your doctor regarding the exact timing of when you should get the COVID-19 vaccine or its booster shot after having recovered from the illness itself. Another question that we as doctors get asked is it possible to get the COVID-19 vaccine at the same time as another vaccine, like say the flu shot or the pneumonia shot? And the answer is yes. Again, also, if you're vaccinated, can you still get COVID-19 or spread it to other people? And unfortunately here, the answer is also yes. Some vaccinated people still get COVID, but the symptoms are less severe. And unfortunately, yes, you can also still have zero symptoms and still spread the virus to other people. In terms of getting the vaccine while a person is pregnant or breastfeeding, and again, the answer is yes. Since the vaccines were rolled out starting in December 2020, there have been studies showing that pregnant women who were vaccinated were able to pass along a significant amount of antibodies to the babies that were born, and it gave those babies an increased level of protection against COVID compared to the babies of mothers who were unvaccinated. Another topic that does get talked about a lot is, do I need a booster shot, either that third dose or even the fourth dose that's been talked about in the news recently? And the answer would be yes. There is extensive research that has been done that shows that a booster is needed to provide protection against the Omicron variant. With regards to the fourth dose, we do not routinely recommend a fourth dose at this time, although research is ongoing, and as the pandemic unfortunately continues to evolve, it is possible that you might need that the general population would need a fourth dose of a COVID-19 vaccine. But that being said, that's still to be determined. As of right now, the only segment of the population that really does merit consideration for a fourth dose of the vaccine, that is a second booster shot, would be those who are immunocompromised. These would be the patients who have AIDS or have cancer undergoing chemotherapies to suppress their immune system, or patients that received an organ transplant in the past and take medications to suppress their immune systems. Again, also the one other thing to keep in mind for those who are immunocompromised, and we'll talk about this in a little bit also, is for those who are immunocompromised, the interval between the second dose and the booster is 3 months, not 5 months. But in terms of for the rest of the population, for those who did get a vaccine and those who are trying to figure out if they're eligible for a booster shot or not, basically, if you received the PFIZER vaccine for your first 2 doses, then it's recommended that you get a booster shot at least 5 months after having gotten that second dose. Really, anyone who has age 12 and up should be getting a Pfizer or should be getting a booster shot. If you're above the age of 18, then it is you're able to get both either the Pfizer or the Moderna vaccines as your booster. But for people aged 12 to 17, then only the Pfizer booster shot has been studied in that population. So that's why we recommend that you only get the Pfizer booster shot if you're between the ages of 12 to 17. If you got the Moderna vaccine, again, if you're age 18 or older, then it's recommended that you also get a booster shot at least 5 months after having gotten your second dose of the Moderna vaccine. And similarly to anyone age 18 and older who got the Pfizer shot, we recommend you get a booster, and it'd be either the Pfizer or the Moderna vaccines. Either one would be fine in that context. For people who got the Johnson & Johnson vaccine, aka the Janssen vaccine, we recommend that anyone who was 18 and older who got the J&J shot get a booster at least 2 months after having gotten the Johnson & Johnson shot. Note that's 2 months, not 5 months. But otherwise, in terms of which booster you can get, we currently recommend that you get either the Pfizer shot or the Moderna shot for your booster shot in that setting. In terms of vaccinating for kids, this is something that has been continuously talked about over the last few months. Currently, right now, anyone under the age of 5 is not eligible for any of the COVID-19 vaccines. But that discussion is ongoing. So if that news, or if basically the guidelines change in the next few weeks, again, don't be surprised because the discussion is ongoing. But as of right now, no one under the age of 5 is eligible to get any of the COVID-19 vaccines. Only the Pfizer vaccine has been given that authorization to be distributed to kids between the ages of 5 and 18. And otherwise, everyone, again, age 18 and older should get 1 dose of either the Pfizer or the Moderna vaccines, at least 2 doses after having gotten that Johnson & Johnson vaccine. For those who are immunocompromised, again, that's talking about patients who, like, say, have, AIDS or are undergoing cancer therapies where their immune systems are suppressed or have received an organ transplant and are taking medications to suppress their immune system, if those people got 1 dose of the Johnson & Johnson vaccine, we recommend that 2 doses of either the Pfizer or Moderna vaccines be given. If you fall into this category, or if you're not sure if you fall into this category, then the best thing I would say is talk to your doctor to clarify if you would be eligible for 1 or 2 boosters. Talking now about testing, because that was a significant issue, especially around like the holidays or like the Christmas, New Year holidays, at the height of the Omicron surge. There are 2 different types of tests that are available. The first one is a PCR test. That's the type of test that we use in hospitals, and it's preferred due to higher accuracy rates compared to antigen tests. The reason why these aren't widely available outside a hospital is because the turnaround time is longer. It can be upwards of 8 hours. And the one other sort of confounding issue that healthcare providers do run into is that sometimes a PCR test can detect evidence of a prior infection that had occurred weeks or months ago before the test was done. And at that point in time, the patient is no longer considered to be infectious or contagious. So whenever these tests do get done, obviously the doctors do need to factor in a lot of things. The more common type of test that you do see outside the hospital, the one that gets sold in pharmacies like, say, Walgreens or CVS or elsewhere, is the antigen test. And these are done more rapidly, and they're more accessible with a faster time to result than some of the PCR tests rather. And the benefit here is that the antigen tests allow for self-testing without having to go to a clinic or testing site. The drawback, though, is that they're what we call less sensitive. That is, you can get a lot of false negatives where a person will do an antigen test and then it comes back negative, but it turns out they actually have COVID. So that being said, again, context here is important. So if there is a person who undergoes an antigen test, turns out to be negative, but if there's still like a really high concern for that person to have COVID, like let's say they have the symptoms of COVID, like coughing or loss of sense of taste, loss of smell, then a negative antigen test might require further evaluation, whether that be done by a doctor or a repeat test in about 3 to 7 days, or a follow-up with a PCR test. With regards to obviously quarantining and also isolation, if you can say, God forbid, get exposed, the guidelines did undergo some revisions back at the height of the Omicron surge back in December. But basically, if you were exposed to someone who had COVID and you're not up to date with your COVID-19 vaccines, that is, you're not vaccinated or you're not boosted, then we recommend that you quarantine for at least 5 days. That is, you stay at home and you have to wear a well-fitted mask, like say a surgical mask or an N95, if you have to be around others in your house. We recommend you don't travel, and you also try to get tested if that's possible. After the 5-day quarantine period is up, we also recommend that you still continue to watch for your symptoms until at least 10 days from when you last were in contact with that person who had COVID. And also, again, avoiding travel until it's been a full 10 days. That being said, if you do develop symptoms, then you obviously need to isolate immediately and get tested while staying at home until you know the results. The one difference is that if you are exposed to someone with COVID-19 and you are fully up to date on the COVID-19 vaccines, that is, you're fully vaccinated and you're boosted, then you don't need to quarantine. We do recommend you get tested while watching for symptoms, but the good news is that you don't have to quarantine at home if you're fully vaccinated and boosted. If you do develop symptoms, though, same as if you're unvaccinated, please isolate immediately and get tested at that point while wearing a well-fitted mask if you have to be around other people. And now, for people, God forbid, who do have a positive test for COVID, at that point, regardless of whether or not you are vaccinated or boosted or unvaccinated, we recommend you stay at home in isolation for at least 5 days. And if you have to be around other people in your house, to again wear a well-fitted mask, like say an N95, a KN95, or a surgical mask. When it comes to when that isolation period can end, at that part there are different things to factor in. If a person tested positive but never had symptoms, after that 5th day, then you can your isolation's over. You're done. But if you did have symptoms after that 5 days, then multiple things need to happen. First, the person's symptoms need to be improving. Second, the person needs to be without a fever for at least 24 hours, and that time without a fever has to occur without the use of fever-reducing medications like acetaminophen, also known as Tylenol. The one caveat we do include is that if a person was severely ill with COVID-19, think about people who have to get hospitalized for COVID-19 treatments, or if the person is immunocompromised, like I mentioned earlier, like AIDS patients, cancer patients, organ transplant patients, then those people should isolate for the full 10 days because of the increased risk. Regardless, we recommend that until that day 10, people do wear masks that are well fitted, again, like N95s, KN95s, surgical masks, anytime you're around others inside your house or if you go in public. And again, now talking about the different types of masks, there are 3 different types of masks that we are typically available for most people. The first ones are the N95s or the KN95s, and these ones offer the best protection against COVID. These are made up of layers of filtering material that trap at least 94 to 95% of high-risk particles. The difference is that a KN95 uses ear loops and is made to Chinese medical standards for medical masks, whereas an N95 does not have ear loops. It wraps around the back of a person's head and is made to the US healthcare standard. That being said, surgical masks are also effective, not as good as an N95 or KN95, but they are inexpensive. And they are made up of 3 different layers that provide good filtration. Not as good as an N95 or KN95, but they still do provide a significant layer of filtration. And then the last one that we see a lot are the cloth masks. These can be good, but it's best if you choose one that's focused more on function rather than fashion. Cloth masks that have multiple layers offer the most protection amongst cloth masks, especially if a filter can be added, like if there's a little pocket inside the mask for a filter to be added. The one thing I would say though is that, and this is part of the reason why cloth masks are starting to fall out of favor, is that cloth masks by themselves don't do as much to protect you from inhaling particles that carry COVID. And unfortunately, with a strain as infectious as the Omicron variant that is now the most common variant here in the United States, that becomes a problem. In terms of COVID-19 treatments, God forbid a person does get infected with COVID-19, outpatient-wise, there are different types of what we call infusions. That is medications that can be given through a person's veins. These utilize what we call monoclonal antibodies, which you've probably heard about in the news. The first one I'll talk about is a medication called sotrovimab. This one has been shown to be effective against the Omicron variant, but again, it can only be given intravenously. It can be given as late as 10 days from the start of a person's symptoms. Another one that was just recently given emergency use authorization is a medication called bebtelovimab. This one is also known to be effective against the Omicron variant, but unfortunately can only be given intravenously. And this one can be given as late as 7 days from the start of symptoms. Depending on whether or not you may have been the recipient of an outpatient COVID treatment or know someone that has. There used to be 2 other medications called Regeneron and bamlanivimab. These used to have what we call emergency use authorization from the FDA, but unfortunately they were found to not be effective against the Omicron variant. So back in December, when the Omicron variant surge was ongoing, or had started rather, the FDA removed the emergency use authorization for those last 2 medications. Not on this slide, and technically not a COVID-19 treatment, there is another medication given as an infusion called Evusheld, and that's a combination treatment that's designed for pre-exposure prophylaxis against COVID-19, and this would be for people who are at high risk, like the immunocompromised, like I've been talking about. If you feel like you might be eligible for that, then the best thing to do would be to reach out to your doctor to determine if you would be eligible for Evusheld. In terms of outpatient treatments, again, fortunately, almost 2 years now into when the pandemic first arrived here in the U.S., we do have more treatment options, including outpatient medications that can be taken by mouth. The first one that we can give is a medication called Paxlovid. And this is a combination of 2 medications called nirmatrelvir and ritonavir. The idea is that these medications are given together twice a day for 5 days. Ideally, a person should be taking these as soon as possible after being diagnosed with COVID and within 5 days of when the symptoms first started. The one thing I would say, though, is please make sure that if you do get a prescription for Paxlovid, please tell your doctor that all the different medications that you take, because The medication called ritonavir, it does have interactions with a lot of other medications, including cholesterol medications. So please tell your doctor all the medications you take before starting on Paxlovid. There is another medication that can be given called molnupiravir. This also is a medication that's taken twice a day for 5 days, and again should be taken as soon as possible after a person is diagnosed with COVID, and again within 5 days of when the symptoms started. The one thing to keep in mind, and again this is if you're watching and if you live in Alameda County, as of right now, only hospital pharmacies in Alameda County are able to dispense Paxlovid and only able to dispense molnupiravir. If you're watching this outside of Alameda County, that may not necessarily be true, so the best thing to do would be to talk to your doctor if you live outside Alameda County. But if you live here in Alameda County, and you feel like you would need a prescription for one of these two medications, you would need to be evaluated by a doctor, likely in a hospital, or they're able to just contact that hospital pharmacy and give you the prescription for these medications. When it comes to inpatient COVID-19 treatments, there hasn't been as much change over the last year or so. The mainstays that we give inside the hospital are a medication called remdesivir, and this is a type of medication that inhibits the viral and genetic replication of COVID-19 inside a person's body. Then there's also a medication called dexamethasone. This is a type of steroid. It helps decrease the swelling that occurs inside a person's airway, so it allows air to get in out of the lungs more efficiently. And then there's one last medication that we do give called tocilizumab. This is another type of antibody treatment that is given as like a one-time dose, but it's reserved for those who are critically ill or if they're rapidly worsening. And those would be the types of patients who need to go to an intensive care unit and they need to be hooked up to a breathing machine, have a tube put inside their mouth and hooked up to a breathing machine. Those are the types of patients we would save tocilizumab for. When it comes to the variants, obviously this has been another major topic in the pandemic over the last year now. The one thing to keep in mind is that unfortunately viruses, not just COVID, constantly change through mutation, and new variants of a virus are expected to occur over time. Most COVID variants are currently classified into 3 categories, and that would be the variants being monitored, the variants of interest, the variants of concern. And there is a 4th category called variant of high consequence. That category shows evidence of that prevention measures or medical countermeasures have significantly reduced effectiveness. Fortunately, no COVID variant falls into this category yet. But the one thing to talk about the variants, typically when we talk about variants and why they become a problem, it's because of one of several reasons. That includes an increase in transmissibility, that is, they're more contagious. They can have there is a significant reduction rather in neutralization by antibodies created by a previous infection or vaccination. Sometimes these variants can be associated with a reduced effectiveness of treatments, which is why the Regeneron treatment is no longer authorized by the FDA. The same goes for bamlanivimab. And then very rarely you can see what we call diagnostic detection failures, where a COVID test may not be able to pick up a variant, although that hasn't been as much of a concern as the other reasons that I outlined on this slide are. In terms of notable variants, there have been numerous that have been popping up over the last year. Just as a quick rundown, there's the Alpha variant, the Beta, the Delta, the Gamma, and the Omicron variant. Scientists do continue to study these new mutants while looking for new variants throughout the world. But the one thing I can reassure right now is that the current vaccines we have available here in the U.S., specifically the PFIZER and MODERNA vaccines, do provide significant protection against these variants. Another question we do get asked a lot is the recovery period from COVID, and unfortunately, this is very variable. The time to symptom resolution depends upon premorbid risk factors. That is, how sick was a person before they got COVID? Like, did they have a lot of other medical issues like heart disease, lung disease, dialysis, diabetes? Also, depends on the severity of the acute illness. Like, did the person just stay at home in isolation for the 5 days, or were they did they need to have an extended stay in an intensive care unit? And it also depends on the symptoms that were experienced. The time to resolution is, again, very variable. Some symptoms such as fevers, chills, loss of sense of taste, loss of sense of smell typically resolve within 2 to 4 weeks, whereas others may last for months. The term for these symptoms, sometimes known as long haulers, is more formally known as post-acute sequelae of SARS-CoV-2 infection, also known as PASC, or abbreviated as PASC. And there's a wide constellation of symptoms that can occur here. That includes fatigue, gastrointestinal problems, what we call brain fog, like that inability to focus, as well as psychiatric issues such as depression, anxiety, insomnia, as well as impaired lung capacity. Research is ongoing in this field. Unfortunately, right now, there is no specific medication that has been authorized or approved for PASC. It's right now just supportive care, although hopefully that does change in the future. And then one other question that we get asked a lot is, of course, when is this pandemic going to end? And unfortunately, we don't have a real clear timeline for when the pandemic will end. There has been talk, if you've followed the news over the last couple of weeks, about this transition to what we call endemic, and that is ongoing. It's basically to the point where COVID isn't gone from our society. COVID's still there, but the impact that it has been reduced to the point where we're able to go back to our regular lives, like the lives that we had back in 2019. Unfortunately, a lot of things do need to happen, though, for us to get fully into that endemic phase and out of that pandemic phase. And that includes achieving herd immunity. It's not clear how many people will need to be vaccinated. We also need vaccines that provide effective protection against all of the COVID-19 variants, not just the ones we have now, but also ones that will provide protection against possible future variants. And then, of course, we also need acceptance of vaccinating, which unfortunately has been a very contentious issue for really more than a year now. In terms of what you can do to help to end the pandemic or to get out of this pandemic phase, first, get vaccinated as soon as you can. If you have concerns about if you can get a vaccine, please reach out to your doctor. Encourage others to get vaccinated if it is safe for them to do so, and to help stop the spread of COVID-19. If you feel sick or if you do have signs of COVID or symptoms of COVID, please quarantine immediately, get tested, call a doctor, and follow all doctor and public health instructions. And thank you for your time today.
Thank you, Dr. Catalya. We do have a few questions here. The first question is, if I have already had COVID, do I already have the antibodies to prevent a reoccurrence?
So a person who does get infected with COVID-19 will have naturally occurring antibodies, but the problem, though, is that a person who has only naturally occurring antibodies does not have as good of a layer of protection as a person who has been vaccinated against COVID-19. A person who is vaccinated against COVID-19 will form stronger antibodies to provide more significant protection. And also, people who are vaccinated against COVID-19 will have cells in their immune system that are more trained, better conditioned to fight off COVID as well. And that doesn't occur with people who are not vaccinated.
Thank you. Our next question, how long does the vaccine last? Will I need it again next year?
So the vaccine protection that a person gets from the vaccines is for a long time. It's at least, for several months, for many months. In terms of will you need another shot, like a third dose, like a fourth dose or more going forward, it's still to be determined. It's going to depend on how the rest of the pandemic plays out, and it's going to depend on if there's any new variants that hopefully don't pop up in the future.
Okay, our next question, how is COVID-19 different from the seasonal flu?
So the seasonal flu is caused by a different virus. It's caused by a virus called influenza that also has a significant ability to mutate. That's the reason why we recommend, or people have been recommending for years, to get a new flu shot each year. COVID is caused by a type of virus called the coronavirus. And as we've seen, unfortunately, whereas the flu is more seasonal, occurring more so in the wintertime, COVID can unfortunately infect anyone really throughout the year. That's why we saw surges during the springtime and during the summertime last year with the Delta variant.
Okay, and our last question regarding gatherings of large groups, how safe is it?
So I would say that if a person is fully vaccinated, is boosted, and has received their booster shot rather, it's reasonable for that person to go outside and, interact in large gatherings with, certain degree of, sense of safety. If you want to bring an N95 mask or a surgical mask with you, that's definitely perfectly reasonable to do. Whenever I go out to a restaurant or, to like a tourist destination, I usually wear still an N95 mask or a surgical mask. But for those who are not vaccinated, you basically don't have any protection, or you have the same amount of protection that you did when the pandemic started before vaccines were given. So at that point, you have to sort of think of things in, say like a 2020 standpoint, where you need to wear a mask at pretty much all times if you're going to go outside and interact in large crowds. And you need to practice that social distancing still, staying 6 feet away from everybody else.
Okay, well, this concludes our program. Thank you, Dr. Catalya, for this insightful presentation. And thank you, viewers, for tuning in. For COVID-19 information at Washington Hospital, visit our website at whhs.com/COVID. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.